Yes, I'm just wondering about the repercussions for those who are not immunized in the healthcare sector post-October 26th. Is it reassignment or dismissal? How does that work? And just briefly to follow up on the first part, restaurants are trying to get used to this vaccine card. Many of them don't have the tools needed to do the scanning. Will there be supports provided for them to help scan the QR codes, or do you expect them just to continue to do visual checks?
Yeah, so to the second question, the scanning is very simple because it's not an app that downloads any information. So yes, we have supports, and there's a number they can call. There's a website. We'll be updating best practices and how to do these things. And we've had a number of calls over the last week with different sectors to help support them in this. But visual is just as good because that's the beauty, I think, of the simplicity of this card. In terms of healthcare workers, yes, it's going to be a condition of employment. So obviously, if there are medical reasons, if there are strongly held belief, religious reasons, these will be, there'll be a central process to review these, and there'll be opportunities for accommodation. And in some cases, that may mean people being reassigned. It may mean that people being assigned to separate areas, having to take additional measures, like being tested on a regular basis. But the ultimate end for people who choose not to be immunized, who work in healthcare, is leave without pay.
Our next question is from Shannon Patterson, CTV. Shannon, please go ahead.
Oh, hi there. Sort of similar to Richard's question, how many total workers are we talking about for this new healthcare sector vaccination mandate? And do you have any concerns that you talked about some being let go if they, don't comply, but that you may see people quit, and then the healthcare sector could be short-staffed because people just won't accept it and they'll quit their job?
So I don't have numbers for you, actually, but what we're talking about is everybody who works or works for the health authorities or in a contracted organization, and it's across the board. So where it doesn't apply is probably easiest to say it doesn't apply as a condition of employment for people who don't have privileges at any health authority facilities or work at any health authority facilities. So if you're a private practitioner, a physiotherapist, or a physician who works in the community and doesn't have any privileges or work in a healthcare setting, then it would not apply to you because there's not that employer relationship. But yes, the things that we need to take into account, there are very few people who cannot be immunized with these vaccines for medical reasons, and those are things that we will be paying attention to, obviously. And we will be looking at the necessary things to accommodate people. But we also know that having healthcare workers get sick is very disruptive and causes shortages. We've seen that in places across the province right now. And that is much more likely in unvaccinated healthcare workers. And there are settings like long-term care, like many of our settings like Cancer Agency, where we have immune-compromised people who are much more susceptible and cannot mount a strong immune response themselves. So there are settings where we cannot afford to have unvaccinated healthcare workers working. I will say as well that the percentage of vaccinated healthcare workers is very, very high. Doctors of BC, it's in the high 90s, 96, 97% of physicians across the province who are immunized. It's in the high 80s to 90s for nurses. So there are small pockets of people who are not yet vaccinated. And this is an important part of our responsibility as healthcare workers. One, to keep ourselves well, to make sure that we're able to care for people, especially through stressful times like this, but also to ensure that we're not infecting our colleagues or potentially bringing it into a setting where the vulnerable people we care for may be affected. We know how disruptive outbreaks are in acute care, in long-term care, and we know how damaging they can be. There is a shortage of healthcare workers across this country. So yes, I know it's going to be one added stress, but I also know that there's very, very strong support from our professional organizations and from healthcare workers across this province to ensure that they and their colleagues are vaccinated to best protect each other, but also to make sure that we can continue to deliver care.
Thank you. Dr. Henry, you said there are small pockets of unvaccinated healthcare workers in BC. I'm wondering if you could be more specific. I know employers were asked to provide some data to your office over the last few weeks. So can you walk us through how many or what percentage of healthcare workers are unvaccinated and explain how that has shaped the policy that's been announced here today?
Yeah, I wish I could. I can't at the moment yet. We've had some challenges in getting that information in. All of it has come in over the weekend, so it's still being analyzed. And what that is on a facility-by-facility basis. Every individual who works in long-term care is being accounted for so that we can understand which facilities have lower immunization rates and help us understand which ones are more at risk of having outbreaks. I know there, and I can't. I know there are some facilities in the north. There's a couple in the Fraser region, but I don't have those data at my fingertips right now. We can put that together as we get more information in the coming days. But that takes care of the long-term care and assisted living facilities. We don't have that individual level data on all workers in acute care and community care. So we're looking at how we get that information in a different way through a number of different databases. So I don't have the details on that yet. I don't know if you want to speak to that.
Just say, Justine, roughly speaking, if you look at long-term care and assisted living, we're talking about 49,000 people. This is the category of people who on October 12th were required to be immunized. In response to the earlier question, I'm trying to remember who it was. We'll get the full numbers across health authorities. Remember that the Fraser Health Authority is the second largest employer in the province, roughly 30,000 employees. Not all of those will have this applied to them, but a very significant number of them. So these involve a large number of people. And once we have the information, we'll be providing the sharing of information probably at next week's briefing to talk about where we stand and the progress we have to make between now and October 12th to get the maximum number of people immunized in long-term care. Overall, a lot of people have been immunized in long-term care, a very large majority of people. But when you go down facility by facility, there's some that are less than we'd like, and we're making significant efforts in every single one of them to raise immunization rates now, and in order to give everyone an opportunity to meet that test on October the 12th. But what we're talking about are measures that are affecting across the province, certainly more than 100,000 people in total, these two sets of measures, and that's a lot of people who are required to be immunized. And I just want to say finally about those people that this is a group of people that's done exceptional and extraordinary things for them, and this will be one more of them, one more of those things to ensure that everyone is immunized. And it's a challenge, but it's one that we simply have to meet in these times. Since we announced our decision to increase hiring in long-term care and in August and September of 2020, 5,000 positions have been added, which is a significant effort as well to try and support the sector. But it is, of course, a concern, and that's why we want the maximum number of people to get vaccinated and make sure everyone has every opportunity to get vaccinated prior to October the 12th.
Justine, do you have a follow-up?
I do, thanks. Then I guess I'm still wondering what it is that's driving the policy change today. So we knew about long-term care, and it was pretty clear what some of the concerns were there. So what is driving the change and the need to add healthcare workers, and what kind of response are you expecting from the healthcare unions that have in the past fought very hard against mandatory vaccines when it's related to the flu shot?
Yeah, so I think it was always our intention to support all healthcare workers being immunized, and we've been in ongoing negotiations with unions through the Health Employers Association of BC, but also working with the colleges and the associations that support healthcare workers. And the Canadian Medical Association, the Canadian Nurses Association, and other organizations here in BC have also come out with support for the importance of protecting healthcare workers so that we are able to fulfill our jobs, but also to ensure that we're doing the best that we can for the population we care for. So there's a lot of support for this, recognizing the impact that this virus is having on us individually, but also on our healthcare system. So it is something that has been in the works for some time. I did want to make it very clear today because there is some talk, we started with long-term care recognizing it was the highest risk setting, and there's some concerns that healthcare workers in long-term care would leave long-term care and move to other parts of the healthcare sector where they would not necessarily need to be immunized, and I wanted to make it very clear that that's not something that we would that is going to be able to do because the risks are similar in many settings across the healthcare spectrum. So it is something that we've been negotiating and working through. So I just wanted to make it very clear before we get to October 12th that that's not an option for people who are trying to avoid being immunized.
Our next question is from Lisa Euston with News 1130. Lisa, please go ahead.
I'm just wondering if you can ballpark, and perhaps this is Minister Dix, how many people this is going to affect by October 26th. You mentioned the 30,000 in Fraser Health. Is it around 50,000, 60,000 people overall in the province?
No, it's more than that. We're 120,000 healthcare workers, I think it is, approximately.
And we'll provide an estimate.
We can provide you with that, but just let me. I mean, the rates of immunization in healthcare workers across the board are higher than the provincial average. When we're talking about nurses, or physicians, or care aides, the different union groups, so this is not going to adversely affect a large proportion of healthcare workers.
That's right, Lisa, and we'll get you some more exact numbers. It's not there will be some people who are health authority employees, people who say work in an accounting job or something like that, who this would not necessarily apply to. But overall, it's going to apply to sort of patient-facing staff across health authorities, and we'll give you an estimate on that. But it's a significant number. It's certainly overall, if you count long-term care and assisted living, certainly north of 100,000 people. So that's a lot of people working in healthcare in BC. And what you see, and part of the reason why the long-term care and assisted living thing would naturally move to acute care as well, is there's a significant number of people in acute care who are effectively either waiting for a long-term care bed or what are called alternate level of care patients who are effectively long-term care patients. And we've seen in the course of the pandemic in some places at some time, this group of patients has been particularly affected in acute care by COVID-19. So the need to do it across sectors, the need to ensure that facilities that are essentially doing the same thing across sectors have the same application of a vaccine requirement is why we're doing this. And we'll try and get you by your people's deadlines, which I know are now 24/7. We'll try and get you as soon as possible just an estimate of the kind of numbers we're talking about to provide precision on that. But it's a significant number and certainly north of 100,000 people.